ICD 10 cm Practice Questions and Answers 2026 with explanations. 30 Fundamental Questions. Question 1. Which organization is responsible for the development of the ICD 10 cm coding system? AMA, NCHS, CMS, WHO? The National Center for Health Statistics, NCHS, is responsible for the ICD 10 cm diagnosis codes, while CMS handles ICD 10 PCS. Question 2. What does the fourth character in an ICD 10 cm code for diabetes mellitus typically indicate? The type of diabetes, the body system affected or complication, the severity of the disease, the age of the patient. In the E08-E13 categories, the fourth character often specifies the etiology, anatomical site, or nature of the complication. Question 3. If the type of diabetes is not documented in the medical record, what is the default code type? Type 1, Type 2, secondary diabetes, gestational diabetes. Per ICD 10 cm guidelines, if the type of diabetes is not specified, the default is type 2 diabetes mellitus. Question 4. Which character is used as a placeholder in ICD 10 cm to allow for future expansion? XZ0, 9. The letter X is used as a placeholder in certain codes to allow for expansion while maintaining the code structure. Question 5. A patient is seen for a follow-up of a malignant neoplasm that has been excised, with no further treatment and no evidence of malignancy. What code category is used? C00C96, primary malignancy, D00D09, in situ, Z85, personal history of malignant neoplasm, Z08, follow-up exam. Category Z85 is used when a primary malignancy has been removed/excised, there is no further treatment directed to that site, and no evidence of any existing primary malignancy. Question 6. When coding an encounter for HIV, what is the only condition that allows code B20 to be sequenced first? HIV-related illness is the reason for admission. The patient is a carrier of HIV, asymptomatic HIV status, a follow-up for HIV screening. Code B20 is sequenced first only if the patient is admitted for an HIV-related condition. Question 7. What does MRSA stand for in clinical coding? Methicillin-resistant Staphylococcus aureus, multiple resistant Streptococcus aureus, mildly resistant Staph aureus, metabolic resistance systemic action. MRSA stands for methicillin-resistant Staphylococcus aureus. Question 8. In ICD 10 cm, codes in brackets in the alphabetic index indicate optional codes. The secondary code for an etiology/manifestation pair. Primary diagnosis codes. Excludes 1 notes. Brackets are used in the index to identify manifestation codes that must be sequenced after the etiology code. Question 9. Which instructional note indicates that the codes listed should never be used at the same time as the code above it? Excludes 1. Excludes 2. Includes. Code also. Excludes 1 means not coded here and indicates that the code excluded should never be used at the same time as the code above it. Question 10. The late effect of a previous condition is now referred to in ICD 10 cm as complication, sequela, manifestation, etiology. A sequela is the residual effect, condition produced, after the acute phase of an illness or injury has terminated. Question 11. What is the maximum number of characters an ICD 10 cm code can have? 3, 5, 7, 9. ICD 10 cm codes can range from 3 to 7 characters in length. Question 12. When a patient has both an acute and a chronic condition and there are separate codes for each at the same level of indentation, How are they sequenced? Chronic first, then acute. Acute first, then chronic. Alphabetical order. Coder's choice. Per guidelines, if the same condition is described as both acute and chronic, and separate codes exist, the acute code is sequenced first. Question 13. Which code category is used for factors influencing health status and contact with health services? V codes, W codes, Z codes, M codes. Z codes, Z00, Z99, are used for encounters where a patient is not currently sick but is seeking health services. Question 14. An external cause code, V00Y99, should be used as a principal diagnosis, never be used as a principal diagnosis, only be used for work-related injuries, be ignored if the injury is minor. External cause codes provide additional information about the cause of injury but are never sequenced as the primary diagnosis. Question 15. In the tabular list, which symbol indicates that a code requires additional characters? Point dash, dot, check mark, asterisk, circle. The point dash symbol, example K29, indicates that the code is incomplete and requires additional characters. Question 16. Code first notes are found in which part of the ICD 10cm manual? Alphabetic index, tabular list, Appendix A, chapter guidelines only. Code first and use additional code notes are found in the tabular list to guide proper sequencing. Question 17. If a patient is admitted with sepsis due to E. coli, which code should be sequenced first? E. coli infection, sepsis, the localized infection, fever. For sepsis, the code for the systemic infection, sepsis, is sequenced first, followed by the code for the causative organism. Question 18. The term NOS stands for not otherwise specified. New outpatient system, not on schedule, none of the symptoms. NOS is the equivalent of unspecified and is used when the documentation does not provide enough detail for a more specific code. Question 19. The term NEC stands for newly established code, not elsewhere classifiable, non-essential condition, next expected code. NEC is used when the medical record is specific but the coding system does not have a specific code for that condition. Question 20. Which ICD 10cm chapter covers diseases of the circulatory system? Chapter 1, Chapter 9, Chapter 10, Chapter 20. Chapter 9, codes I00, I99, covers diseases of the circulatory system.